All right, I'm back. So now we talk about, as a nurse, how do we prevent sensory overload or sensory deprivation in our clients? We've kind of touched on it as I've been talking. We definitely want to control the patient's discomfort whenever possible. That could be in deprivation or overload. So if it is in deprivation, we need to stimulate the patient, encourage some physical activity if they're able to, unless they're on bed rest, and maybe have some secondary care, such as a massage or essential oils or some music that might stimulate them. For overload, then we want to kind of do the opposite. Let's decrease the activity for a little while, maybe turn the lights down, decrease the amount of visitors that are coming through, provide privacy. And if you are working with someone who has some sensory issues, like maybe they are blind, make sure that they know what is going on as well around them. Make sure that they, if they're sitting up and they're going to be eating, that you guide them. Let them know what is on their plate, where it's at. Use the face of a clock. 1 o'clock is your meat. Let's see, 6 o'clock would be where your potatoes are, and as such. So use social activities to stimulate them. So long-term care, maybe get them to go into the cafeteria to eat or the dining hall to eat instead of eating in their room. If they need a little bit of, if they have some sensory deprivation. Enlist family members to participate in or encourage activities. Provide privacy, we talked about. Offer cares that provide rest and comfort for those with sensory overload. Some of the effects of sensory deprivation that we've seen is perceptual responses, inaccurate perceptions of sight, sound, taste, smells, body position, coordination, and equilibrium. This can even develop into daydreams or hallucinations when people are so bored, they're just not stimulated. Cognitive responses, they're unable to control thought content. They have a decreased attention span and concentration, mostly because they're tired or they're bored. They have difficulty with memory, problem solving, or task performance. And emotional responses, usually it is depression, sadness, panic, or even some rapid mood changes. Unfortunately, the only real examples I have are my OB moms, and not to be stereotypical as we learned last week, but we do see some rapid mood changes in our women who are pregnant due to hormone changes in their body that they have no ability to control. So you need to be careful. Don't think that just because they do have rapid mood changes that they have sensory deprivation or overload. But that can be one sign of sensory deprivation. Depression is probably your biggest one. Apathy, if you know what that means, you just pretty much don't care anymore. Unfortunately, we see this a lot in our long-term care patients. Now we're going to talk about some of our sensory deficits. Hearing impairment is one of the sensory deficits that you can have, and it's our most common deficit. Sensory or hearing impairment can be due to conductive or sensorineural issues. With conductive, the sound waves cannot reach the inner ear. Sometimes this has to do with earwax building up or cerumen buildup, or a perforated tympanic membrane or bone fixation. Otosclerosis is a genetic disorder of the middle ear bones, and this is a progressive hearing loss. Both ears usually are affected, and it begins in early adulthood. Tinnitus, which some of you talked about, if your patients are taking an aspirin, we know that tinnitus is a side effect of taking too much aspirin. You hear ringing in your ears. Your tympanic membrane is usually red or pink, and there's an increased vascularity. We talked somewhat about the different tests you can do to test hearing impairment. The bone test, the RIN test. We talked about the difference between the bone conduction being greater than the air conduction. The RIN test you can look up in your Weber book. And then our more common, hearing loss is more common in females and in Caucasians. And hearing aids do help. There's also surgery. The cochlear implants can help restore hearing. One of the things we have to do is assessing our clients for these hearing impairments. How do we assess them as a nurse? First of all, we have to make sure that they can hear us when we're asking our questions. It's a good idea to invite someone who's close to them, a family friend, a partner, to come in with them when you're assessing for hearing impairments, because they may give you a little more insight into the client's life. Or when they come home, is the TV up higher than it used to be, the volume? Do they find the person yelling? Does the person get frustrated when they're around children who have a higher tympanic voice versus adults? And sometimes they're much more difficult to hear and understand. There's also sensory neural hearing impairment, and that's the destruction or abnormality of the cranial nerve, cranial nerve 8, which is our acoustic nerve. And usually that can be caused by a tumor, chronic infections of the ear, trauma, or exposure to loud noises. My nephew, who is 18, had chronic ear infections, and just recently he was tested for hearing loss. His mom is a speech therapist and audiologist, and he has a lot of hearing loss in one of his ears because of the trauma of all the chronic ear infections. He had multiple times that his eardrum ruptured, so he's got some loss due to destruction. Or you can have exposure to loud noises. Big idea is to wear earbuds when you're going to these concerts that are super loud, or you're outside working on your lawn and you're using the lawnmower for a long period of time, you're exposed to a loud noise. You see people wearing headphones. Now that isn't just for music. A lot of times it's just to block out that noise. And this is a hard word to say, presbycusis, and that's a hearing loss with aging. That's what you're going to be seeing in our long-term care. They have a difficulty hearing higher frequencies. They're the ones who have trouble hearing children talking. Hearing aids can help about 95% of people if they wear them, if they take care of them properly, if they change the batteries in them. Take a look at some of the hearing aids at these long-term care and tell me if they don't look like they need to be replaced. People tend to forget or not replace their hearing aids, and they are usually covered with Medicaid. So what type of behaviors? We kind of talked just about that. The type of behaviors we notice in people who are going through hearing loss. Do they tend to talk louder? Has their voice changed and they're monotone, or almost like you hear someone who is deaf talking? They have more of a monotone voice. Are we hearing that in our clients? Are they complaining of not being able to hear their grandchildren or hear children? Hearing aids, they can make the speech and sound louder, but not necessarily clearer. So even with hearing aids, people tend to have trouble hearing people that have a higher timpani of voice, such as children. There are many different types of hearing aids. You've seen some that wrap around the ear. You've seen some that are called like the miracle ear, which are very tiny, and they go right into the ear, and they're hardly noticeable. Other options people can do if they don't want to wear the hearing aids is learn to lip read, or they can do some auditory training. There are other assisted devices which we talked about. The cochlear implants have been very helpful, especially those are more helpful in children than they are in adults. So here are behaviors, often others notice first. Constantly asking people to repeat themselves, changes in speech habits and patterns. They may overcompensate and become increasingly louder themselves, and they get irritated very easily and they blame others for mumbling. Nursing diagnoses and interventions for hearing impairments. These will come big to you now that you are writing care plans and you're using these nursing diagnoses. We have a risk for injury related to hearing loss or vertigo. What is vertigo? Vertigo almost makes you dizzy because of trauma to the ear or possibly a tumor in your ear. One thing, risk for injury, you may not hear warning signs such as sirens, fire alarms in your home, honking, automobiles warning you. Anything like that is a risk for injury. Disturbed sensory perception. Provide information and support and assist with those hearing aids and batteries. If you see that those hearing aids need to be replaced, you could bring that up to them and let them know that they can get those replaced, and usually they're covered under insurance. Impaired verbal communication related to hearing loss. If a client wears glasses, assure that they're clean. Because if they're trying to read lips and they can't read through their glasses, I know my 11-year-old has a lot of difficulty cleaning his glasses. I can't believe what he walks around with. And he's going to school and he's playing all his sports, and I look at his glasses and I can barely even see through them. So make sure your client's glasses are nice and clean so that they can look at the person when they're talking. Wave or tap shoulder before speaking. Put the client in a full light so that they can see your face. Reduce environmental noise. So if you're talking to them and you're in maybe the cafeteria or their dining hall, you want to give them their medications and you're asking them questions, it can be very noisy. There's a lot of stimulus in that room. So make sure that you reduce environmental noise, especially when you're doing any type of teaching. Use short sentences, pauses, gestures, and facial expressions. Okay, so don't go on and on and on and on because you may have lost them. Put breaks in there so they can tell you, hey, I don't understand what you just said. Can you repeat that? Provide a writing slate, or now they have iPads, which are very nice to use with our patients who cannot hear or cannot speak, say that they are vented. Rephrase and repeat information. Social isolation. They may need a referral to an audiologist for a hearing aid. They may be very upset with their hearing loss, and they may isolate themselves because they feel like they keep asking people to repeat themselves and people are getting upset with them, and they don't want people to know that they can't hear them, especially someone who may feel that this is telling them that they're getting older. Okay, so they don't want the hearing aid. That's for an old person. That's not for me. So they may sit there and not be able to hear because they don't want people to think they're old. All right, we're going to go on to talk about visual impairment disorders. I think I'll save this for our next video. So for now, we're done with this one. I'll post this one and we'll start with visual impairment disorders with the next video. Talk to you in a little bit.